Imagine waking up every day, dreading the moment you catch a glimpse of yourself in the mirror. For someone with body dysmorphic disorder, BDD, this anxiety isn't just about feeling a bit self-conscious, it's a relentless mental struggle. BDD creates an intense focus on perceived flaws, often on the face or body, that no one else notices. But to the person struggling, these flaws can dominate their lives, causing anxiety, depression, and social withdrawal. If you've ever felt trapped in a cycle of self-criticism or found yourself fixated on a minor flaw, you're not alone. Let's dive into what BDD really means, its impact, and how to break free from its grip. Body dysmorphic disorder, BDD, is a mental health condition that causes an individual to obsess over perceived flaws in their appearance. These flaws might be minor or even non-existent, but to the person suffering from BDD, they feel glaringly obvious and deeply distressing. It's like looking into a funhouse mirror that distorts reality, but in this case, the distortion is happening in the mind. This disorder goes beyond simple self-consciousness. It consumes the person's thoughts, leading to intense anxiety and, often, depression. Many people with BDD spend hours each day fixating on their perceived imperfections, which can severely impact their daily lives, relationships, and self-esteem. Dr. Catherine Phillips, a leading researcher in the field, notes in her book, The Broken Mirror, that people with BDD often go to extreme lengths to hide or fix these supposed flaws. This might include seeking unnecessary cosmetic procedures or engaging in compulsive behaviors like mirror checking or skin picking. The cycle becomes relentless, leaving little room for joy or connection in life. Those struggling with BDD typically focus on specific features of their face and body. Common areas of concern include the nose, skin, hair, or facial symmetry. They may believe their nose is too big, their skin too blemished, or that their face appears asymmetrical. For others, it's their body shape or muscle tone that becomes the source of fixation. The key here is that these perceived flaws are often invisible or negligible to others. However, to the person dealing with BDD, they feel monumental, leading to intense feelings of shame and self-loathing. It's important to recognize that BDD doesn't discriminate. While women may often fixate on their facial features or weight, men are not immune. Many focus obsessively on their muscle size and definition. In fact, muscle dysmorphia, a subtype of BDD, predominantly affects men who are preoccupied with the idea that they are not muscular enough, regardless of their actual physique. We all have things we wish we could change about our appearance, right? Whether it's that persistent zit that pops up before a big event or those extra pounds we put on over the holidays, it's normal to have some level of insecurity. But there's a significant difference between occasional self-consciousness and the debilitating grip of BDD. In BDD, the distress and obsession over perceived flaws are constant, often leading to hours spent trying to fix or hide these imperfections. Here's where things diverge. While most people can brush off their insecurities and move on, someone with BDD remains stuck, unable to let go of the negative thoughts. It's not just a fleeting worry, it's a deep-seated belief that their appearance is defective. This belief often leads to social avoidance, a decline in mental well-being, and, in severe cases, suicidal thoughts. Understanding this difference can help us recognize when someone needs help rather than just reassurance. Identifying BDD can be challenging because those suffering often hide their distress. However, there are some telltale signs. Individuals with BDD may spend excessive time in front of the mirror or, conversely, avoid mirrors altogether out of fear of what they'll see. They may frequently seek reassurance from others about their looks, but no amount of validation seems to ease their anxiety. This obsessive behavior can consume hours of their day, affecting their ability to work, study, or maintain relationships. Other signs include skin picking, trying to cover up perceived flaws with makeup or clothing, or constantly comparing themselves to others. Some people may even avoid social situations altogether, fearing judgment or ridicule. If these behaviors sound familiar, it's essential to recognize that they're not simply a sign of vanity, they're a cry for help. As Dr. David Veal, a prominent expert on BDD, points out, BDD is often hidden because sufferers feel ashamed of their preoccupation. They think others will see them as vain or shallow, which is far from the truth. Instead, BDD is a serious mental health condition that deserves understanding, empathy, and proper treatment. Muscle dysmorphia, often referred to as bigorexia, is a specific type of body dysmorphic disorder that predominantly affects men, although women can experience it too. Unlike typical BDD, where individuals may focus on facial features or skin imperfections, muscle dysmorphia revolves around the belief that one's muscles are too small or underdeveloped. This belief persists even when someone has an objectively muscular physique. For those affected, no amount of weightlifting, protein shakes, or muscle gains seems to satisfy the relentless urge to be bigger and better. Imagine feeling like no matter how hard you train, it's never enough. Muscle dysmorphia can lead to excessive time spent at the gym, strict diets, and even the misuse of anabolic steroids. This obsession isn't just about fitness, it's a distorted view of self-worth tied to appearance. Those with muscle dysmorphia may avoid social activities, fearing judgment if they miss a workout or eat something outside their strict regimen. The pressure to meet an unrealistic ideal can be mentally exhausting. It's easy to see how muscle dysmorphia overlaps with eating disorders. Both conditions involve an unhealthy fixation on body image and food intake. However, the key difference lies in the focus. While traditional eating disorders like anorexia nervosa focus on becoming thinner, muscle dysmorphia centers on becoming more muscular and bulkier. People with muscle dysmorphia might consume an excess of protein, count every calorie, or restrict themselves to clean foods in an effort to build muscle mass. In both cases, the underlying issue is the same, a distorted self-image that impacts one's mental health. As psychologist Dr. Roberto Olivardia, an expert on muscle dysmorphia, highlights, the pursuit of the perfect body often comes at the cost of mental well-being. These individuals become trapped in a cycle where they can't see their progress and only notice flaws. What exactly causes someone to develop body dysmorphic disorder? Like many mental health conditions, it's often a combination of genetic, environmental, and psychological factors. If someone has a family history of obsessive-compulsive disorder, OCD, or other anxiety disorders, their risk of developing BDD increases. This suggests there may be a genetic component at play. But genetics alone don't tell the whole story. Growing up in an environment where physical appearance is heavily emphasized can also contribute to BDD. Social media, for instance, bombards us with filtered images and unrealistic beauty standards, making it easy to fall into the trap of comparison. Adolescents, in particular, are vulnerable as they are still forming their self-image and often measure their worth through external validation. Low self-esteem, past trauma, or a history of bullying can also be significant risk factors. If someone has been teased or criticized about their looks, this can plant the seeds of self-doubt and insecurity that may later manifest as BDD. Understanding these causes is crucial because it shows us that BDD isn't simply a matter of vanity, it's a deep-rooted mental health issue driven by complex factors. Is there a relationship between BDD and OCD? Yes, body dysmorphic disorder, BDD, and obsessive-compulsive disorder, OCD, share a close relationship. In fact, BDD is often considered part of the obsessive-compulsive spectrum. Both conditions involve intrusive, obsessive thoughts and repetitive behaviors aimed at reducing distress. For someone with BDD, the obsessive thoughts focus on perceived flaws in their appearance, while the compulsions might involve mirror checking, seeking reassurance, or picking at their skin. Interestingly, research suggests that around 30% of people with BDD also meet the criteria for OCD. The overlap lies in the anxiety-driven rituals. Just as someone with OCD may wash their hands repeatedly to ease anxiety, someone with BDD might check their reflection dozens of times a day to confirm or disprove their fears about their appearance. But the relief is only temporary, and soon the cycle begins again. This is what makes both BDD and OCD so debilitating. The compulsions provide a fleeting sense of control, but in reality, They only fuel the underlying anxiety. Body dysmorphic disorder doesn't exist in isolation. Often, it's intertwined with other mental health challenges, particularly eating disorders. BDD and eating disorders share a similar obsession with body image, but their focus differs. While those with anorexia or bulimia may strive to lose weight, individuals with BDD may fixate on a specific facial feature or a perceived physical imperfection. However, the common thread is an intense dissatisfaction with one's body. This dissatisfaction can lead to harmful behaviors like restrictive dieting, excessive exercising, or even self-harm. The constant focus on appearance can drain one's emotional and mental resources, leading to depression, anxiety, and social isolation. For some, the pressure becomes too much, resulting in self-destructive behavior or substance abuse as a way to cope. Dr. Cynthia Bulick, a leading researcher in eating disorders, emphasizes the drive for physical perfection often leaves individuals chasing an impossible standard. It's not just about wanting to look good, it's about feeling fundamentally flawed. This struggle goes deeper than vanity. It reflects a deep-seated belief that one's worth is tied to appearance. Recognizing that you or someone you care about might have body dysmorphic disorder can be overwhelming, but there's hope. The first step is acknowledging the issue. BDD is not something you can simply snap out of. It's a genuine mental health condition that requires compassion, understanding, and professional support. If you're experiencing distressing thoughts about your appearance, reaching out to a mental health professional can be life-changing. Therapy can help you untangle the obsessive thoughts and compulsive behaviors that keep you stuck. Cognitive behavioral therapy, CBT, is one of the most effective treatments for BDD. It helps you challenge distorted beliefs and learn healthier ways of coping with your feelings. For some, medications such as selective serotonin reuptake inhibitors, SSRIs, can also reduce symptoms, especially when combined with therapy. The road to recovery isn't easy, but it's entirely possible. Effective treatment options for BDD often include a combination of therapy, medication, and self-help strategies. Cognitive behavioral therapy, CBT, remains the gold standard, particularly a specialized form called exposure and response prevention, ERP. This approach encourages individuals to gradually face their fears, whether it's going out without makeup or resisting the urge to check the mirror, without engaging in their usual compulsive behaviors. Medication, especially SSRIs, can help manage the obsessive thoughts and anxiety that accompany BDD. However, medication alone is rarely enough. It works best when combined with therapy and lifestyle changes. Support groups can also play a crucial role, providing a safe space to share experiences and realize you're not alone in the struggle. If you or someone you know is struggling, don't hesitate to reach out to a body dysmorphic disorder helpline. Professional guidance can help turn the tide and bring relief to what may feel like an unending battle with your own reflection. Self-help tip 1: refocus your attention. When you're caught in the relentless grip of body dysmorphic disorder, your mind can become like a broken record, stuck on replay. The thoughts about perceived flaws and imperfections consume your mental energy, leaving little room for anything else. One powerful way to break free from the cycle is to refocus your attention on activities that engage your mind in a healthier way. It may sound simple, but redirecting your focus can help quiet the inner critic and shift your perspective. Think of your attention as a spotlight. When it's constantly pointed at your insecurities, it can feel blinding. But by consciously turning that spotlight towards something else, you can ease the intensity of those critical thoughts. This doesn't mean you're ignoring your feelings. Instead, it's about giving yourself a break from the endless analysis and allowing your mind to breathe. Believe it or not, focusing on mundane tasks can be incredibly grounding. Simple activities like washing dishes, folding laundry, or organizing a drawer can become a form of mindfulness. The goal here isn't to avoid your thoughts, but to anchor yourself in the present moment. These tasks can pull you out of your head and into your body, helping you feel more connected and less overwhelmed by your thoughts. Try this. The next time you find yourself spiraling into obsessive thoughts about your appearance, pause and engage in a mundane task. Focus on the sensory experience, the warmth of the water, the texture of the fabric, or the sound of items being sorted. By immersing yourself in the moment, you can create a mental reset and break the cycle of negative thinking. Meditation is another powerful tool for managing the intrusive thoughts that come with BDD. It's not about trying to silence your mind, but learning to observe your thoughts without getting swept away by them. Over time, meditation can help you develop a healthier relationship with your inner dialogue. Instead of reacting to every critical thought, you learn to watch them pass like clouds in the sky. Start small. Even just 5 minutes a day can make a difference. Focus on your breath, noticing how it feels to inhale and exhale. When your mind inevitably wanders back to thoughts about your appearance, gently bring your focus back to your breathing. This practice isn't about perfection, but about persistence. With time, you'll find it easier to detach from those self-critical thoughts and see them for what they are, just thoughts, not reality. Tip 2. Practice self-compassion. We tend to be our own worst critics, especially when dealing with conditions like body dysmorphic disorder. But here's the thing. Beating yourself up won't lead to change. It only deepens the pain. Instead, practicing self-compassion can be a game changer. When those harsh thoughts arise, imagine how you would respond if a friend came to you with the same worries. You'd likely offer them kindness and reassurance, not judgment. So why not extend that same grace to yourself? Self-compassion isn't about letting yourself off the hook or ignoring your struggles. It's about recognizing that you're human, that suffering is part of the shared human experience, and that you deserve kindness just as much as anyone else. According to Dr. Kristen Neff, a leading researcher on self-compassion, being kind to yourself in moments of struggle helps you cope more effectively with difficult situations. By shifting your mindset from self-criticism to self-care, you can start to heal from the inside out. One practical way to practice self-compassion is to write yourself a letter. Whenever you feel overwhelmed by negative thoughts about your body, take a moment to write down what you're feeling. Then, respond to yourself with the same kindness and empathy you would offer to a dear friend. This exercise may feel strange at first, but it can be incredibly healing, creating a buffer against the harsh inner voice that often drives BDD. Tip 3. Start a journaling habit. Journaling is more than just putting pen to paper. It's a way to connect with your innermost thoughts, especially when dealing with the whirlwind of emotions that body dysmorphic disorder stirs up. Writing down your feelings can provide a safe outlet, giving structure to the chaos in your mind. It's like taking a flashlight into the dark corners of your thoughts, illuminating what's been hiding there. When you see it on paper, it's easier to challenge those harsh judgments. Don't worry about writing perfectly. This isn't for anyone's eyes but your own. Let yourself be honest, brutally so, if needed. Write about your fears, your frustrations, and even the days when it feels like your appearance defines your worth. But also, write about the small victories, the moments of relief, and the kindnesses you've shown yourself. Over time, you may notice patterns and triggers, and this awareness can help you take back control. One powerful exercise is to write a letter to yourself from the perspective of someone who loves you unconditionally. How would they comfort you? What would they remind you of when you're struggling? Journaling in this way can shift your perspective, opening your heart to self-compassion in moments of deep self-doubt. Tip 4. Reduce negative predictions. Let's be real, our minds are often our own worst enemies. When you have BDD, it's easy to fall into the trap of negative predictions. You might think, if I go to that event, everyone will stare at my flaws, or if I don't fix this, I'll never be happy. But here's the truth, these are just thoughts, not facts. Our brains love to jump to worst-case scenarios, especially when we're anxious, but those predictions rarely come true. One technique to combat these negative predictions is cognitive restructuring. Start by writing down the fearful thought. For example, everyone will judge my skin. Then, challenge it. What evidence do you have for this? Is it based on past experiences or just fear talking? Replace that thought with a more balanced perspective, like, most people are too focused on themselves to notice. This isn't about sugarcoating reality, but about reminding yourself that your fears are often exaggerated. You can also practice a quick reality check by asking yourself, what would I say to a friend who had this thought? Chances are you'd reassure them and help them see things more clearly. Offering yourself that same kindness can break the cycle of negative thinking and open up new possibilities for a healthier mindset. Tip 5. Seek social support. No one should have to face body dysmorphic disorder alone. Yet, it's common for those struggling to isolate themselves out of fear of being judged or misunderstood. But here's the thing: opening up to trusted friends, family members, or support groups can be a lifeline. Just knowing that someone else understands, or is at least willing to listen, can lift some of the burden you're carrying. Social support is more than just venting your feelings. It's about feeling seen and validated. It's about realizing that you're not the only one fighting this battle. A heartfelt conversation over coffee or a phone call with a friend can remind you that you are so much more than your appearance. Studies have shown that social connections play a crucial role in mental health. According to psychologist Dr. Julian Holt-Lundstad, having strong social relationships improves mental well-being and can even increase life expectancy. If opening up to someone you know feels too vulnerable, consider joining a support group for people with BDD. Sometimes, talking to others who truly understand what you're going through can be transformative. You'll find solidarity, shared experiences, and maybe even some new coping strategies. Remember, seeking support is not a sign of weakness, it's a sign of strength. You don't have to carry this alone. As a parent, discovering that your child is struggling with body dysmorphic disorder, BDD, can be heartbreaking. You want to protect them from the harshness of the world, but when the harshness is coming from within their own mind, it feels even more overwhelming. The good news is that with patience, understanding, and the right support, you can make a profound difference in your child's life. But it all starts with acknowledging the problem and being willing to face it together. First and foremost, listen without judgment. Children and teens with BDD often feel deeply ashamed of their perceived flaws, so when they open up, it's a huge act of trust. Instead of dismissing their feelings as silly or irrational, validate their emotions. Phrases like, "I can see how much this is hurting you," can go a long way in helping them feel understood and supported. Remember, the issue isn't about vanity, it's about intense anxiety and self-criticism. It's also essential to create a safe, non-judgmental space at home. Be mindful of how you talk about your own body or others' appearances. Kids are incredibly perceptive, and they pick up on more than we realize. Encourage body positivity by focusing on what bodies can do rather than how they look. For example, celebrate strength, health, and the ability to move, dance, or play, rather than focusing on weight or physical appearance. If your child is showing signs of BDD, professional help can make a world of difference. Cognitive behavioral therapy, CBT, tailored for adolescents, can teach your child coping skills to challenge negative thoughts and reduce compulsive behaviors.